Good morning. This is Group 3 and we're going to present Polycystic Ovarian Syndrome. Also known as PCOS, this is a common endocrine disorder that affects 5 to 20% of women of reproductive age. Now, according to the World Health Organization, this condition affects 6 to 13% of women globally, yet up to 70% of these cases are still undiagnosed. In the Philippines, around 4.5 million Filipinas are living with PCOS. PCOS has unknown causes, but it can be described as where your ovaries produce too many androgens, which leads to hormonal imbalance in your reproductive system. It is also chronic, but it can be moderated with living habits that is considered healthy and medical treatments. So how will you recognize PCOS? You can look at its symptoms as a spectrum. Symptoms may vary per individual by how it changes over time, how it occurs without clear trigger, and how intense it could be. Sometimes, an individual can experience no symptoms at all. As I've mentioned, excess androgen is a recurring theme in this presentation, where it could lead to acne or oily skin, hirsutism or excess hair growth, and sometimes hair thinning. Now, what connects these individuals is their irregular period, the heavy, long, and unpredictable cycles caused by too much androgens, and without its regular ovulation, may cause difficulty in conceiving, hence infertility.
Now, PCOS may complicate some normal things that you should have experienced and make you more prone to certain diseases and situations such as infertility, gestational diabetes, miscarriage or premature birth, non-alcoholic steatohepatitis, metabolic syndrome, type 2 diabetes or prediabetes, sleep apnea, depression, anxiety and eating disorders, and finally, endometrial cancer.
Before we tackle endocrine cause and metabolic impact with respect to PCOS, we must first create an understanding of which organs and hormones are key players in the process a normal female body should go through during a menstrual period. From there, we'll be able to analyze what discrepancies cause the succession of errors, following which ultimately results in the polycystic ovary syndrome. So first, let's talk about what hormones and vital organs are involved in irregular menstrual cycle. So it originates from the hypothalamus, and the hypothalamus releases a hormone called GnRH or gonadotropin releasing hormone, and it travels in the bloodstream to the pituitary gland, the anterior pituitary gland to be specific. And this signals the gland to produce FSH or follicle stimulating hormones and LH luteinizing hormones to travel to the ovary via the bloodstream as well. And these balanced hormones cause about 6 to 12 follicles in the ovary to wake and mature. And as they do so, they produce estrogen hormones and cause the uterus lining to build up. And at the end of their maturity cycle, one of the follicles becomes dominant, and it moves to the edge of the ovary and produces an egg, while the other follicles that are not as dominant, they disintegrate after a few days. And meanwhile, the follicle that was dominant and released the egg, it seals over and becomes what is known as a corpus luteum, and this produces progesterone. And this corpus luteum, this progesterone, has a negative feedback on the GnRH, and it signals for it to reduce in production and maintain normal frequency range. Meanwhile, the produced egg either stays in the uterus when fertilized or disintegrates otherwise, and then the uterus lining formed earlier is what would be your period. Okay, so what happens when there's a hormone imbalance? So the primary starting point of PCOS is actually at GnRH, the abnormal pulse frequency it is in. So it's actually increased, so there's too much, along with LH, and it lowers the amount of the follicle stimulating hormone. And this will cause the follicles in the ovary to actually not be able to mature and ovulate. And so there would be an absence of both the corpus luteum and the surge of progesterone that women need. And this leads to a higher pulse frequency seen in PCOS. So the follicles that fail to ovulate evolve into cysts that form on the ovary, and they represent failed follicular ovulation events. And additionally, excessive LH levels stimulate thecal cells to produce higher amounts of androgens, also known as male sex hormones like testosterone. And so this is what causes symptoms like hair growing on, let's say, the face of women. And this is not something that is normal, but it happens due to the large amount of androgens. And so that's sort of like a side effect of that excess hormone. And here we also have a flow chart of how it occurs. So first you have the hypothalamus, and then the abnormal GnRH frequency affecting your anterior pituitary, and then insufficient FSH is here, and then you have your overproduction of LH, which trigger your thecal cells to produce androgens. And now let's go over what other kind of impact this irregular production of hormones can have on your body, specifically your metabolic function. Now, as we can see, the word insulin is related to androgens here. Now, what do these two hormones have to do with one another? So let's talk about that. So insulin is released in the pancreas and affects the thecal cells in the ovary. This is a vicious cycle propelled by the insulin resistance formed by the significant amounts of androgen in the ovary, thus leading to decreased sensitivity to insulin, a condition known as hyperinsulinemia, which in turn triggers the pancreas to create more insulin, causing more release of androgens, and the cycle repeats. So when the pancreas produces more insulin to counteract the overproduction of androgens, the ovary just produces more androgens, which makes the pancreas produce more insulin. So it's just a repeating cycle. And so these two organs are sort of just trying to fight one another, trying to overpower one another by overproducing specific hormones. To add on to that, when a person has hyperinsulinemia, this is actually something that puts a woman at risk for prediabetes or even diabetes, because cells aren't efficiently taking up the glucose, and this is what makes the pancreas compensate by producing more insulin. And so as you can see, PCOS really isn't just one main experience. So it's a chain of symptoms, and when someone has this, they're at risk for even more diseases and illnesses that could stack up eventually if they don't take the right steps towards recovery.
Treatment of PCOS revolves around managing the symptoms through lifestyle modifications and medication. Lifestyle changes include a healthy diet where you focus on fruits, vegetables, and lean protein, regular exercise to help with weight loss, which can improve insulin sensitivity and hormonal imbalance, weight management, which can sometimes significantly improve the symptoms, and sleeping for 7.5 to 8 hours per night to help manage the symptoms. Now on to medication, there's progestin, often prescribed as part of a birth control pill, which helps regulate menstrual cycles and can lower androgen levels to reduce acne and hair growth. Now, there's also metformin, which can be used to help with insulin resistance, regulate cycles, and decrease androgen levels. For other pills, there's also combination birth control pills that contain both estrogen and progestin, which decrease androgen production and regulate estrogen. This lowers your risk of endometrial cancer and correct irregular bleeding, excess hair growth, and acne. Now, it's important to note that you should consult a healthcare provider to create a personalized treatment plan and for careful diagnosis, because currently has no cure, but its symptoms can be managed effectively with treatment. Treatments can take at least 6 months to show results, so consistency is the key.